a few words of introduction now. This webinar is the first of the 2024 series. It's part of our communication campaign, Achieve Better Milk Together. At Vetoquinol, we aim at working hand in hand with our stakeholders to achieve more for vets and farmers, cows and consumers, which means healthier cows and herds, a better quality of life, supporting sustainability of milk production. Beyond products, we're aiming at providing solutions, helping to solve your and your farmers' pains. In mastitis treatment, with diagnostics and fit-for-purpose protocols. In mastitis prevention, with products and management tools, and partnership in data management to help you provide attractive services. Our topic tonight, practical approaches to cattle pain management from detection to treatment. Our speaker is Professor Raphael Guatteo. He's a veterinarian. He's got a PhD, diplomate of European College of Bovine Health Management. He's currently full professor of bovine health management at ONIRIS, the former vet school of Nantes in France, and is involved deeply with ECBHM and EBVS, and of course, member of a lot of bovine associations. But now I will leave the floor to Raphael and let him present his talk. Raphael, the floor is yours.
Yeah, thank you, Stefan. Can you see my screen?
Yes, we see.
Okay,
now.
So good evening, everyone. Really happy to see so many attendees for this webinar, and I would like first take the opportunity to thank Vetoquinol and especially Stefan for their kind invitation to give you this talk. As Stefan mentioned, about the practical approaches to cattle pain management, okay? Just before beginning the presentation, I just would like to see with you what will be the outline of the presentation. So in the first step, we'll try to have some very basic definition and maybe a short review about the mechanism of pains, especially in regards to the strategy of using painkillers afterwards. The second part of the presentation will be devoted to the pain detection in cattle. How can you, on a daily basis, detect pain in cattle? And the last part of the presentation will be devoted to pain management, and especially focusing on the 3S approach for suppress, substitute, and soothe pain in cattle. So just before beginning the first part of the presentation, we propose you a very short poll to make the presentation a bit more interactive and also to have your idea and perception about a specific question. So Stefan, if you can open the first question.
So the first question is, what would you say? Cattle are a species that doesn't feel pain, don't express a lot of pain, or express pain on its own way?
Feel free to would like to give.
Yes, we have quite a lot of answers. I think it's not increasing a lot anymore. So I will stop the now. So the vast majority of you said that cattle express pain in its own way.
Okay. Thanks, Stefan, and thanks to all the attendees. For sure, if we think about what could have been the results 20 years ago, maybe it would have been a bit different. But I think over the past decades or during the last 20 years, I think we made great achievement to demonstrate that cattle do feel pain, for sure. So, but when we talk about pain, what are we talking about? One of the issues for a very long time was the fact that there was no clear definition about what is pain in animals and especially in cattle. So the basics, even still today, is to use the definition which is used for humans. It's more or less an extrapolation. And so the International Association for Study of Pain define pain as an aversive and sensory experience. presenting awareness of a damage or a threat to the integrity of its tissue. And I think it's very important if we translate that into animals, so we can replace human by animal, let's say. That's at least my proposal. It's interesting to note at this stage that there might be or not any damage, okay? It can be a real damage or the threat that the animal perceives. Why? Because it will lead to a change in animal physiology and behavior to reduce or to avoid the damage and reduce the likelihood of its recurrence, etc. So I would say that from a very basic perspective, pain is pretty good for the animal because it's supposed to reduce or to avoid the damage. Okay. But in a second step, you can have non-functional, non-useful, we can say pain, and this is occurring when the intensity or the duration, both, of the experience is not appropriate for the damage, okay, especially if none exists, for sure, and when the physiological and behavioral responses are unsuccessful to alleviate the pain. So I think it's very important to notice that it can be a real damage or a threat, for sure, and pain normally is useful for the animal, but in some extent, in some condition, it can lead to non-functional, non-useful pain. Another important aspect when you talk about pain is also to clearly define what we are talking about. And here I would like to take the opportunity to define two terms that we could use in the rest of the presentation: hyperalgesia and allodynia. Okay, hyperalgesia is an increased pain when a same noxious stimulus is repeated. Okay, so let's consider, for instance, that you have a surgery, so you have a wound. Okay, so for sure, if you touch the wound, it will be maybe more painful than it should be normally. Okay, but in some cases, you can have also allodynia. Okay, and allodynia is far different from hyperalgesia because allodynia means that the animal will suffer from pain even when the stimulus is normally not painful. Okay. And just to give you an example, I think that many practitioners are attending the conference tonight. If you are facing chronic lame cows, you have sometimes the feeling that you just have to touch the cow to the head, to the shoulder, or to the tail, or wherever, and the cow seems to suffer from pain for every, I would say, single movement you do, or you just have to touch the animal, and you have the feeling that she perceives pain, okay? And for me, clearly, this is allodynia, and allodynia frequently occurs when you move from acute to chronic pain and that you did not treat pain early enough. So early detection and management is really crucial, okay? Regarding hyperalgesia, we have some possibility using, for instance, ketamine or also NSAIDS for sure. But when you are facing allodynia, it's very hard to treat using painkillers. Just a very few things about the mechanism of pain, okay? As you all know, everything's begin by a tissue damage. You have an inflammatory soup sensitizing the nociceptors, okay, leading to peripheral sensitization for sure. You have an information then which go through the peripheral nerves to the spinal cord, and then you have a central sensitization through with the cortex with integration, and then go back to the animal, and then you can have some responses, and the pain then is there. And I think that it's very important to keep in mind that you have these three stages, I would say: the inflammatory soup, the transmission of the signal through the nerves, and also the integration at the cortex level, because these are the three main targets or three main levels where you can expect an effect of some analgesic or anesthetic drugs. Okay? For instance, it makes sense for sure to use NSAIDs to reduce as much as possible the inflammatory soup. Okay, but for sure you will use also local anesthetic to block the transmission of the signal through the nerves. But you have also the expectation to wait for an effect of NSAIDs, for instance, even a central effect. This is also the goal of alpha-2 agonists, for instance, like xylazine. But keep in mind that NSAIDs have an effect both on the peripheral but also central sensitization. Another interesting thing when we talk about pain is to know which kind of pain are we talking about, okay? We can divide, I would say, pain in three main categories: somatic pains, such lameness, fracture, disbudding, dehorning, for instance. It consists in pain concerning the body, so including the skin, the bone, the muscles, the tendons, okay, and other tissue. We can also talk about visceral pain, when the pain came from the internal organs. So from a very practical perspective, as a practitioner, this is typically the type of pain you will face when you have to treat pneumonia, metritis, peritonitis, castration, for instance, C-section. But you have also neuropathic pain, which concern pains coming from nerves, the spinal cord or the brain, because you have an abnormal processing of nervous activity. And especially regarding chronic pain, at a given time, the central nervous system doesn't know exactly how to proceed with all that information. And then we move from hyperalgesia to allodynia, okay? And this is typically the pain that we can observe in cattle, for instance, after rubber ring castration. I don't know the situation in your country, but I know that in France, it's pretty familiar for the farmer to castrate the calf using rubber rings. And we know that it's probably the procedure which caused the most intense chronic pain for calves, in comparison, for instance, with Burdizo or with a surgical castration. Chronic pain, lameness, etc. Clearly, you can have such kind of neuropathic pain, okay? So different origins, different pains, and probably different strategy to approach and especially to treat pain. And just keep in mind, once again, that when you have to face neuropathic pain, unfortunately, the painkillers that we have, such as NSAIDS, are not as effective as they can be for somatic and visceral pain. Last but not least, regarding the first part devoted to definition, it's also to talk about the duration of pain, okay? So we can make the distinction between acute and chronic pain for sure. So acute pain usually associated with defensive body processes. As I told you before, it's more or less the useful pain, we can say, okay, immediately following the injury. And normally it's supposed to disappear when the injury heals, okay? But then it can lead to subacute or to chronic pain, especially when pain is too intense or lasts for too long, okay? And then we move to chronic pain. So I know that in humans, usually they use the threshold of 2 to 3 months. So I don't know exactly if we can use exactly the same duration for cattle, but for sure, once again, when we are treating some lame cows, sometimes when we ask to the farmer, the cow is lame for maybe 2, 3, 4 months, etc. And clearly the cow is suffering from chronic pain. And regarding the chronic pain, I will say once again, we can divide this pain in 2 categories: either chronic inflammatory pain, okay, when the healing persists beyond the expected time. And in that kind of pain, maybe we can still expect an effect, especially of NSAIDS and multimodal approach. We will see that on the last part of the presentation. But when you are facing chronic neuropathic pain, it's a bigger issue, because unfortunately the painkillers will not be as effective as they can be for the other type of pain. And clearly it's due to a lack of early detection and management of pain. So the take-home message for me regarding this first part, regarding to the definition of pain, in my opinion, the doubt should benefit to the animal if you are not sure if there is a painful process or not, first. But most importantly, as soon as you detect something that you can rely or link to pain, you need to treat that as soon as possible to avoid the installation of chronic pain, and especially chronic neuropathic pain. And to do that, NSAIDs clearly are the first-line treatment, both for vets and for farmers. So now we can move to the second part of the presentation. I will say more practical, devoted to how we can detect pain in cattle. So Stefan, once again, I think we have a short poll for the attendees.
Yes, here it is. So we will ask you, among the following criteria, which ones do you think are the best to consider to detect pain among food-producing animals? Physiological criteria, behavioral criteria, zootechnical criteria. So we have a lot of answers. I will stop now. And 75% of answers are saying behavioral criteria.
Okay, so very good students tonight. Okay, maybe no need of that webinar. We can go back to dinner. You're right. I mean, even if you click on the other answer, you're right also, because you can use the combination, but for sure, zootechnical is probably too late, and physiological criteria are maybe not very practical, okay, in routine practice. So to dive into pain detection, I would like to share with you the results of a study that we conducted some years ago in France. Here, we asked to the farmers that you can see here on the map of France from different areas, from dairy area, from beef area. We asked to the farmer from their perception what could be the clinical signs that we need to put forward to detect pain. Okay, and interestingly, as you mentioned by the poll, they mentioned general behavior, facial expression. I think it's really something very important, gait and posture, vocalization, and they were all agreed to state that decreased performance could be linked to pain for sure, but they were considered as too late, okay, not early enough in the process, okay. Interestingly, fever was also reported as a pain sign, and we will see afterwards which kind of consequence it can have in terms of use of drugs, okay. Interestingly, no difference between dairy and beef farmers, because sometimes there is some rumors that beef farmers can be less sensitive to pain management or pain detection. Here, the results were exactly the same. But there was, as I mentioned before, an amalgam, a confusion maybe between the severity of the disease, the presence and presence of pain. But nevertheless, pain is really pain detection relies on observation of the animals. It is very important. During the same study, we asked to the farmer to rank among the different range of condition, to rank the condition that they considered as the most painful. So the three main were lameness, digestive diseases, and mastitis. Okay, so not surprisingly, very frequent diseases for sure. When the cow is lame, it's because she suffers from pain. When we talk about, for instance, peritonitis or reticuloperitonitis, for sure the cow is suffering from colic. For sure it's painful, and the same with mastitis, and it's inflammation of the udder. Okay, but interestingly, these are frequent disease. But when you look at the procedure using drugs, both by farmer and vet, sometimes painkillers are not really included as a first-line treatment. Initially in France, I know that 10 years ago, when a cow was lame, it was more the use of antibiotics, especially with zero-time withdrawal time, that were used instead of NSAIDs. Regarding digestive disease, it's maybe more antibiotics with corticosteroids, for instance, rather than NSAIDs. And for mastitis, I think it's still not the mode to use NSAIDs in addition to intramammary tubes. So even if we all agree that these are painful conditions, maybe we can think about the fact if whether or not we prescribe painkillers as a first-line treatment during this condition. And when we look at recent data produced by the team of Nottingham, and especially John Reynolds, they asked to the vets to rank or from 1 to 10 to give a pain score, I would say, for each of the following conditions, from dystocia to uveitis, okay? And they asked also to the respondents if they use NSAIDs as a mode, so in more than 50% of the cases, okay? And as you can see, there is quite a good overlap, and they declare to use more or less systematically NSAIDs for the condition that they scored the highest. It makes sense. But as you can see, for some of them, there is a sort of discrepancy for improvement, okay? And interestingly, when you look at the criteria among the respondents that could explain a higher sensitization to pain, I would say, or a higher probability of using NSAIDs and painkillers, clearly the age is very discriminant. Okay, the younger vets use more frequently NSAIDs, and especially the female vets in comparison to the male one. Okay, so when we look at the statistics, we have probably plenty of opportunity to treat pain. We just have to think about if whether or not we do it on a regular basis, or do the farmer do that on a regular basis. So probably still room for improvement. And we ask exactly the same question regarding not this time condition, but surgery. Okay, so not surprisingly, they declared that obstetrical interventions such as C-section or dystocia were very painful for the cow, but also dehorning and disbudding and trimming. Okay, and once again, mainly indication for pain management in theory, but when we look into practice, I don't know the situation in your country, but for instance, regarding trimming, it's not so frequent to use painkillers regarding trimming, and a high number of farmers still dehorn or disbud the calf without any anesthesia or analgesia sometimes. So probably still room for improvement once again. Okay. And when we look at the results of this survey, which was conducted in the EU, so it was 10 years ago, so maybe the results will slightly be changed today, but nevertheless, it's always interesting to look from where we start. And as you can see here, depending on the condition or surgery we're talking about, castration, C-section, claw amputation, or dehorning. As you can see here in green, these are the results from the Europe. And in orange, it's the French part of the study, okay? And as you can see, for instance, for C-section, you have a clear difference between 10 years ago, between French vets and the French from the other part of the Europe that answer to the survey, maybe due to different regulation, expectation, society expectation, maybe. In some other conditions, such as, for instance, dehorning and the use of local anesthetic, it was clearly at that time due to regulation, okay? But for some of other conditions, there is no real rules or regulation that could explain the difference, except maybe the perception that you can have, okay? Because I think that interestingly for pain management and pain detection, I think it's not all about science, you know? If you take 100 vets facing BRD, I think they will all use antibiotics, maybe not the same antibiotics, maybe not the same duration, okay? But if 100 vets are facing a same painful surgery, painful disease, etc., probably the use of NSAIDs will not be as systematic as it can be for antibiotics when facing BRD. Because I think that when we talk about pain, we talk also about values, sometimes religion belief, some perception of what the farmer do expect or what the society thinks, etc. So I think when we talk about pain, it's not only about science, and this is probably something we need to keep in mind, okay? And I mentioned earlier that the farmers sometimes make a confusion between the severity of the disease and especially the existence of fever and the existence of pain. So for sure, it's rubor, dolor, calor. So yeah, it makes sense when we talk about inflammation to wait for fever and pain, okay? But interestingly, when we ask to the farmer which kind of product they will use as a first-line treatment to treat pain, as you can see here, 28% of them declare that they will use antibiotics. So probably that if you treat the condition, and the condition is infectious, it will lead to decreased inflammatory soup and then decrease pain for sure. But it's a long-term effect or a mid-term effect. It's not a short-term effect, okay? So for instance, if you have an abscess to the teeth, for sure you will take antibiotics, but you probably take paracetamol to decrease the pain. So don't know once again the situation in your country. I will be happy to share your thought and perception in your country during the Q&A session. But I think we really need to keep in mind that sometimes in the mind of the farmer, it's not always very clear which kind of drug is supposed to use to treat pain. And so when we look about the different possibility that we have from a very practical perspective to detect pain, as you can see on the figure at the right of the slide, you can use behavior, physiology, production, or even health. And I think that the earlier criteria in the process is probably behavior, okay, for sure. So many benefits of looking at behavior because it's very early in the process. It doesn't cost a lot except time, okay? And you don't need very refined or sophisticated test, code device, etc. So you can really rely on observation, okay? Interestingly, when you look at different books 30, 40 years ago, cattle were very frequently reported as very stoic animals, okay? Because they are prey, they don't express a lot, okay, not to be hit by a predator. To be honest, I work with cows now for 20, 25 years now, and when I look at the cow, for sure, maybe that, and as you mentioned earlier in the first poll, probably they express pain in their own way, probably in a different way than a cat is doing, than a dog is doing, a horse is doing for sure. But when you look at a cow, and especially the face, you can observe a lot of very obvious signs. So maybe the cow are stoic for sure, but they do feel pain. And if you look at the face, if you look at the behavior, you should be able to detect pain. So from a very practical point of view, which kind of clinical signs you can expect, you can look for it to know if the cow is suffering or not from pain. Look at the interaction with the other animal is very important for sure. Individual behavior, because every cow has its own baseline. Abnormal activity, it can concern the line, the gait, the posture, the tail, the head, the neck, for sure. The response to disturbance, you will see afterwards that in the cow pain scale, which is, to my opinion, probably the best grid that you can use today, what they call evoked behavior can be used, okay? So you just try to see how the cow responds, to a disturbance, okay? And usually when the cow is suffering from pain, it's clearly reduced, okay? And ask for the farmer assessment because when you arrive on the farm, the cow is restrained, okay, to allow you to make the clinical examination. So you are not in a very good situation to assess the behavior of the cow, okay? Especially with a rope, the head is like that to do the blood venipuncture. So we need to ask to the farmer what is his perception of the cow behavior in the last hours or days. More deeply, you can look for sure during the clinical examination for additional signs that are very frequently associated with painful condition or painful intervention. So poor body condition score for sure, wounds, makes sense, and clinical signs that are the consequences of the physiological response to pain, such as increased respiratory rates, gasping, open mouth breathing, sweating, trembling, increased muscle tone, dilated pupils for sure, wide open eyes, many of different signs that you can see here on the different picture. And I think that it makes sense for everyone that these cows here are very painful. And for me, the picture of the cow at the left bottom side of the slide is very, very informative in terms of what you can look, the tense of the muscles, the position of the eye, the position of the ear. I think these three criteria are very useful to detect pain. Okay. When you want to deal with some specific disease, you have sometimes some specific grids. I think lameness is probably the disease or the condition for which we have in the literature or on internet the highest number of grid, okay, in 4 levels, 5 levels. So based on the initial grid bomb pressure from 1 to 5, but also other one, especially the one from EDHB in the UK in 4 levels from 0 to 3. I would say, regardless, it doesn't matter which kind of grid you use, as long as you always use the same and you know exactly what is the interpretation of that. So, but for lameness first, the intensity of the lameness is not always linked to the intensity of pain. Sometimes it can be functional lameness, okay? And last but not least, it works for lameness, but not for other conditions. So for other conditions, if you look at the scientific literature, you find some proposal for grids. For instance, that one that we proposed some years ago based on the study that we conducted for pain management around C-section, okay? And we finally built this grid, very easy to use, based on gait, cardiac frequency, head position, hindline position, and the heart line, okay, of the batch. You add the score, depending if it's present or not, abnormality or presence of an abnormal clinical sign, and then we observed that there was a specificity of 100% when the score was equal or above 2. So very easy grid to use for C-section, for instance. Another grid, I will not go to dive into details on that. This is the Vetoquinol grid. It was a grid developed for zebu in Brazil, especially around castration. And once again, I think this grid is very interesting because when you look at the clinical signs, locomotion, interactive behavior, the activity, the appetite, it's all about behavior. It's all about basics, okay? We don't speak about very refined or very detailed or very complex collection of clinical signs, very basic signs, okay? And I think that even if it was developed for castration, probably you can use it also for other type of visceral pain, such as laparotomy or ruminotomy. For me, today, the best grid that you can use when you don't know exactly, when you don't detect that it's clearly a lameness or peritonitis, etc., is to use the Copain scale, okay? It was developed by Glirup and al., so Danish colleagues, okay? And they ask or they advocate to look for 7 criteria. So the attention toward the surrounding. So I will say once again, more or less a sort of evoked behavior also. The head position, okay? The ear position, facial expression, response to approach. So clearly the evoked behavior that we were talking about a few minutes ago, the back position and lameness, okay? And you can look at the figure at the right part of the slide with the head of the cow, okay, the aspects of the head, etc. And I think it's really very, very informative. The ear are coming down. You have exophthalmia. You have the tense of the muscle on the maxillary. So I think these are very, very both sensitive and specific signs of pain. So it leads to that grid. So I will not go too much into details. You will have access to the entire presentation after that. But just keep in mind that you just have to add the points from 0 to 2 for each of the criteria. And the recommendation of the author is to implement painkillers, and especially NSAIDS, when the analgesia score is equal or above 4, okay? And as you can see here, as long as you have a cow with, for instance, exophthalmia and tense muscles, okay, and maybe a neck also very extended, you have already 4 points, and so you do painkillers. So just maybe think about the cow, the last cow for which you had a suspicion of painful condition today when you were in practice just before connecting, and I'm pretty sure that you will have 5, 6, or 7 points on this grid, okay? So once again, very basic things to observe. And then just before moving to the last part of the presentation, I would like to share with you a recent study that we conducted, especially to try to see if we could build some grid very specific of certain disease, because as I mentioned before, you have grid for lameness, maybe one for C-section, one for castration, especially the Vetoquinol grid. The Copain scale is more non-specific, I would say. And the idea was based on the Delphi methods. So I could explain you a bit more in the Q&A session in what is the basis, the rationale for Delphi study. But basically, we asked 2 different experts that are listed here in the table, both from academia and practice, from different countries, okay, to try to build some grid for specific disease. I will show you some results afterwards. And when we obtain a sort of saturation of the answers, I would say as a summary, when all the experts agreed, we had a final grid, okay? And so to give you some example about the different conditions that we were looking for during that study, we talk about BRD, for instance, calf diarrhea, but also the calf after or around birth. And as you can see here, we finally arrived to a grid based on 4 to 5 clinical signs, once again, to make it as much as practical as we can, not to look at 20 different signs. For instance, for BRD, it was considered that a grid combining the reaction to chest percussion, the tense neck, the decreased activity, grunting also, and standing with the 4 legs far apart was pretty indicative of pain, okay? For calf diarrhea, it was mainly relying on tight abdomen, lying boots also, tenesmus for sure, bruxisms, tail flicking. And when we were talking about calf around or just after birth, it was the existence of recumbency, lying with the head down, less engaged in walking and also playing behavior, less time devoted to social feeding, etc. So once again, a very basic observation, okay? And most often all experts agree. And we did the same work for reticuloperitonitis, high disease, and metritis. And as you can see here, we find very frequently the same clinical sign of bruxism, extending neck, tight abdomen, etc. So once again, it's not, to my opinion, too difficult to treat or to detect pain, sorry. If you look at the cow, normally the cow will tell you if they are painful or not, okay? And interestingly, in this last table, and then we can move to the last part of the presentation, we asked to the expert if they consider that you need to wait for different signs before implementing painkillers, or if you had to treat as soon as you observed one signs, okay? And interestingly, when you look at the different experts from A to G, okay, we ask them finally what was the necessary condition to trigger pain treatment. As you can see here, some of them consider that you should implement painkillers as soon as you have one signs. Others consider that you have to wait to have two signs. Others 3, 4, 5, depending on the disease. For me, the main conclusion of that is that the duct should benefit to the animal. If you have a strong suspicion but you are not sure, you should treat. That's my recommendation, but I will be happy to share your opinion about that. And tomorrow, probably it will become easier and easier to detect abnormal behavior or additional clinical sign due to all the different tools and connected tools from precision livestock farming, okay, PLF, the collar, recording activity and rumination, but also the camera with computer vision. You can detect a lot of abnormal behavior, decreasing of the rumination, disturbance of the time budget, etc. So many opportunities from today, but also in the next years to have a better early detection of disease. Okay, so to conclude on that part, for me, it's really back to the basics. Look at the face of the cow. The cattle are not so stoic if you really look at them. The farmer is probably the first sentinel because he's working on the daily basis with the cow. He knows the basic behavior of each cows, or at least of the cows. And the doubt, should benefit to the animal. I think it's really the take-home message. And if you don't know this co-pain scale, really, I can just encourage you to use it as widely as you can. It's very practical and very tailor-made. So we can move now to the last part of the presentation devoted to the pain management. How can you approach the pain management in cows? So Stéphane, we can launch the last
So
point.
here is the third and last question. In your activity, which type of intervention should deserve a better 3S approach? Lameness, castration, mastitis, or C-section?
And 3S approach is suppress, substitute, and souse. So in other words, for which of these conditions do you consider that you can do better than you do now? This is the rationale of the question. Where do you think that you need to maybe to change your approach?
So we leave still 10 seconds, maybe. And we are done. Okay. So 41% said lameness, and then 29% said mastitis. And then we have 14 and 15% for the two others.
Okay, good. So I make a good guess about the disease that we were talking in the following slides. Good. Thanks to all the attendees. So what are we talking about when we talk about the 3S approach, okay? Well, to tell you the story, 10 years ago, I was involved in a scientific expertise for INRA in France, where we were supposed to make a sort of big summary about all the pain that do exist in cattle, in pigs and poultry, etc., and maybe to give some recommendation how to do things better. And we thought about the 3R approach. I don't know if you are familiar with that, which consists in replace, reduce, and refine the use of experimental animals, lab animals, rats, mice, etc., for scientific purpose, okay? So the idea for us was not to reduce the number of farm animals. It was absolutely not the issue. The issue was how can we deal better with pain. And so the idea came to us to mimic the 3R approach by the 3S. So how does it work? First, before doing something to a cow, just think about, is the procedure necessary? For instance, when you have a cow suffering from food disorders, there is no interest to do rectal palpation for sure. So it may be a bit caricatural, but just maybe to think about that sometimes we do things that are painful to the animal and we know that they are not very useful. So then we can skip that. In the past, it can be also the tail docking, for instance, in cattle. I know that in some countries it's forbidden now. Historically, we said that tail docking could be relevant to decrease the risk of getting leptospirosis for the milking man, but also to increase the hygiene of the udder. But we know that this has no effect, so don't need to do that. Okay, so the first question is, do I need to do what I want to do? If no, I suppress. If yes, then you move to the second S, which is to substitute. Because, for instance, if we talk about surgery or if we talk about dehorning, disbudding, we know that, or castration, we know that all the procedures are not equivalent or are not similar in terms of intensity of pain. Okay, so then the idea is to use the techniques that leads to the less pain, okay, as less as you can, okay? And last but not least, if you consider that you have to do a procedure which is painful, and even when choosing the less painful one, there is still pain remaining, then you move to the last S, which is thos, so to treat pain. And then the idea is to use an analgesia, which is as early as possible to prevent chronic pain and allodynia, to use a multimodal approach to block the signals at the different steps, as I mentioned before, and adapt it to the intensity of pain. So just to take an example about the 3S approach, if we take dehorning, for instance, not disbudding, but more dehorning in calves, okay? We know that it's possible to suppress. Some farmers want to have cows with horns, but if you have the possibility in some countries to use genetic selection, you can have calves with no horns. And so then you don't need to disbud them, okay? So for sure, there is a problem sometimes of acceptability of the farmers of cows without horns. And there is also a limit in numbers of bulls, okay, with a poor gene. But nevertheless, you can suppress sometimes. To substitute, we know that we have to perform the dehorning as early as we can to avoid too much tissular damage. Okay, so the recommendation is to do the dehorning before 4 weeks, for instance. And we know that cauteric thermization is less painful than the caustic paste, for instance. So we know that the age or the type of disbudding technique that we use have not the same intensity of pain. So choose the less painful one. And last but not least, when you do dehorning, probably that's what you learn to your farmers, try to make a multimodal approach by combining local anesthetic, but also NSAIDS, because analgesia is different from anesthesia, or anesthesia is not analgesia, okay? So just an example to show you how you can apply the 3S approach on a daily basis, okay? And in that part, NSAIDS for sure are pivotal. NSAIDS are pivotal because, as I mentioned before, you have an effect on the peripheral sensitization. It will reduce the inflammatory soup, but you have also an impact of NSAIDs through the spinal cord, but mainly in the brain by, let's say, with an impact at the level of cortex integration of the message. So NSAIDs have both a peripheral and central action. And regarding the adaptation of the treatment, regarding the intensity of pain, here it's just an example on how we proceed, okay? Sometimes with farmers, we say, okay, that you have the, let's say, level 1, okay? So we don't make two more sophisticated pain scores, etc. But for level 1, the farmer can do the treatment, the pain treatment, let's say, by itself using NSAIDs. For the level 2, for instance, very hard trimming, castration, dehorning, etc. It's always a combination between the farmer and the vet. We can teach some procedure to the farmer, for instance, anesthesia of the corneal nerves. We can also ask to the farmer to make a first administration of NSAIDs, and then we come afterwards to do the local anesthesia before surgery, for instance. And for some condition, from the very beginning, level 3, very painful, I don't know, abomasal surgery, claw amputation, it's clearly the job of the vet. The farmer can do nothing for that. And before giving you some example about what you can expect in terms of benefits of using NSAIDs, just a very short information about the economic impact of a disease as a whole. As a rule of thumb, we can consider that the economic impact of a disease is divided in two parts, losses and costs. Okay, costs, this is what you pay for. Okay, losses, this is the money that it's supposed to be in your pocket, but it disappeared. Okay. And interestingly, when we want to add painkillers, we have to be honest, the idea is to increase the cost, okay, but to decrease the losses. And this is what I will try to show you afterwards, what could be the benefits of giving NSAIDs in order to convince, if needed, the farmer that it's, even from an economical point of view, relevant to treat pain, okay. So you talk about mastitis, and 21% of you, I think, thought that maybe they can do the thing differently in terms of mastitis. So for sure, as I mentioned before, if you put vets in front of mastitis, probably you will not use the same antibiotics, but you will use antibiotics at a given time, okay? But NSAIDs have clearly demonstrated an additional positive effect, for sure, on the renewal and re-establishment of the mammary epithelial barrier. So it's very important, especially for the following lactation. You have plenty of study, especially for very severe mastitis, choline and grade 3 mastitis. There is plenty of study supporting the use of NSAIDs, okay, to decrease the fever, to improve the appetite, to allow the cow to leave the recumbency earlier as possible, and especially also to not only to help to save the cow, but also to save the lactation, because from a farmer perspective, sometimes the cure rate, we'll say, is not only based on longevity of the cow, the survival, but also the survival of the lactation. So keep in mind that when you use NSAID, especially in the early process of very severe choline, you increase the likelihood to make the lactation survive, let's say, in other words. But more interestingly, some recent study conducted, especially in New Zealand, demonstrated by the team by McDougall that adding NSAIDs to the classical treatment of mastitis and even subclinical mastitis had a positive effect, not only on the milking part of the cow, but also on the reproductive tract, with better reproduction performances, okay, with better first IE conception rate, and also a reduced risk of culling. So I think that when we talk about mastitis, maybe we need to include more systematically painkillers and especially NSAIDs, plenty of good things to expect. Regarding lameness, when you look at the economic impact of lameness, here you can see the result of a study conducted in the US, where they try to assess the impact in terms of the milk yield, okay, in terms of days open, etc. What are the impact, okay? And as you can see here, the milk yield was decreased even for the very moderate lame cows, okay? So it means that you can expect, if you treat the lameness as early as possible, you can expect better production, better longevity, okay, less cullings, so very, very good economic point, okay? And when we talk about NSAIDs, just two studies that I would like to show you. This one conducted by the team of Nottingham a few years ago. They compared the effect of different treatment for sole ulcer and white line disease, so claw horn lesion, okay, not infectious ones. And they compared trimming plus block, trimming plus NSAIDs, or trimming plus block plus NSAIDs, depending if the treatment was implemented as early as possible, lameness detected by someone really keen to doing that, or late treatment, so the farmer decided when to treat. And as you can see here, the key is to treat as early as possible, because if you do a late treatment, regardless what you do, it will not work. If you treat as early as possible, as you can see, the cure rate was always above 70%. And if you add NSAIDs, you will increase the cure rate. Why? Because we know that we have more and more scientific evidence that inflammation is really key in the process of creating lameness in cows, and especially claw horn disruption, claw horn disease, due to mitigation, modification of the inflammation of the pododerm, of the chorion, okay? And that's what they demonstrated once again, the team from Nottingham, and the very, very nice study from Wilson, where they created 4 groups of animals that you can see on the top of the slide. Okay, so the cow receive or not NSAIDs, either only when they were trained because they were lame, or as a systematic procedure around calving. Okay? And as you can see, some cow receiving this both or just after being lame or just after calving, okay? And as you can see now at the bottom of the slide, okay, 2 groups were significantly associated with a reduced risk of incidence of lameness, so prevention of lameness. It was group 2 and 3, and if you go back to the top of the slide, the group 2 were the cow that received not only NSAIDs where they were lame, but also systematically 3 days of NSAIDs, okay, for the group 3 at the first calving and also subsequent calving. So it means that treating pain or treating inflammation is key, not only around the lameness occurrence, but also probably around calving, maybe not for all the animals, but we have no more and more evidence that the inflammation burst around calving is really key in the process of occurrence of many diseases, okay? Inflammation around calving is probably the next topic of research for the next 10 years to better understand and better prevent all the diseases that occur after calving in dairy cows. And last but not least, maybe some insight about pain management for promoting calf, because we talk a lot about dairy cows, beef cows, but not so frequently about calf, okay? When you look at the study, very, very nice study, they look at the hypothesis was if we treat pain correctly around castration, especially for young bulls, just before the fattening, it will improve their immunity, okay? And then they will be less sick during the fattening period. And this is what they observed, because when you look at the 2 groups, that are the group receiving meloxicam or placebo, in addition to local anesthetic and during castration, as you can see here, there was a clear impact. It was statistically significant, a lower incidence of BRD because better immunity, okay? You can also maybe expect or look at the interest of doing NSAIDs in addition to the classical therapy of diarrhea. Because the calf is dehydrated, sometimes we think that the side effect regarding renal failure is not really very good for you or not in favor of using NSAIDs. But when you look at that study conducted in Canada, they recruited approximately 60 calves, randomized, either control in addition to the classical rehydration, etc., and classical treatment. And when you look at the statistics, so the mortality was no different between 2 groups, but the daily weight gain clearly increased for the group receiving meloxicam, okay? And there was also an effect on the behavior and the lying boots. So you can maybe think about using more systematically NSAIDs, and last but not least, it will lead as a consequence to a better ingestion of solid, and so an earlier age of weaning, okay? And last but not least, I think it's not because this is a study that we conducted, but I think it's very interesting because we did the hypothesis that if we add NSAIDs in addition to local anesthesia around C-section, it could have an impact on the calf under the assumption that maybe the cow will let the cow suck for a longer time, because I don't know your experience on that, but sometimes after C-section, some cows are more or less reluctant to be suckled by the calves because they are very painful, okay? So that's what we did. We recruited approximately 50 cows, randomly allocated either to receive or not placebo or meloxicam, in addition to local anesthesia, okay? We look for the colostrum quality to be sure that at the end, what we observe in the blood of the calf was really due to the duration of the suckling and not the quality of the colostrum, okay? And so we checked for the parity, age, duration of the C-section, and the colostrum quality. Everything was similar between 2 groups. And when you look at the delay before first suckling between the 2 groups, no difference, okay? Because I think that the delay between the birth and the first suckling is not due to the dam, but more due to the vitality of the calf, okay? But when you look at the level of immunoglobulin in the blood of the calf, interestingly, you see an increase, and it was statistically significant, an increase of the level of immunoglobulins in the blood of the calf born from a dam receiving NSAIDs, in addition to local anesthesia, okay? And why? Probably due to the fact that the colostrum was the same in terms of quality and the delay between birth and first suckling was the same. We can do the assumption that it's probably the duration of the first suckling and then the quantity of colostrum that can get the calf that make the difference, okay? And when we look at the multivariate analysis that we conducted, we observed finally two significant variables in the model. The delay before first suckling, for sure. Quickly is one of the Q of the 5Q rules. Quality, quantity, quickly, quite clean, and quantifying. But as you can see here, there was a very strong effect of giving NSAIDs. So when you treat pain on the cow, you can have some indirect benefit in the calf, okay? So to conclude, I think that NSAIDs, are really interesting in terms of calf health, okay? But pain do exist also for cows. For calves, it does exist and it deserves to be treated. Don't need to make too refined or sophisticated pain detection system. Back to the basics. Observation of the cow, especially the face, as you can see here, both for calves, but also for cows. The tension of the facial muscles, the ear tense, extending net or not, the tension of the muscle above the eye, exophthalmia, increased tonus of the lip, very easy things to look. So maybe look at the face and it will be enough. And if you use NSAID as a treatment of choice, you can use it, or the farmer can use it as a first-line treatment. It will lead to clinical improvement, reduction of impaired performance, and to promote pain management. I think for sure the key is to increase the sensitization of farmers. And maybe a good way to approach this is to promote the 3S approach. So I would like to thank you for your attention, and I will be really happy to answer your question if any.
Great, thank you, Raphael, for this very interesting talk. We are running out of time, but I propose that we answer quite a few questions. Not all, I'm sorry for that, but only a few ones. There was one question about the central action of NSAIDs. If you could precise a little bit briefly what you think about that.
Yeah, so you have so as I mentioned, you have an effect on the peripheral sensitization. It will reduce the inflammatory soup, but you have also an impact on the central system where it will increase the level from which you will have an answer in terms of pain to the animal. So it means that if you give NSAIDs, the animal will resist, I would say, better to the sensation of pain. Okay.
Thank you. We have quite a lot
and to the best of my knowledge, all the NSAIDs are pretty similar to that.
Yes, we have a lot of questions about recommendation about which NSAIDs in which condition is better, etc. I think it's not so easy to answer, or
no, I think to the best of my knowledge in the literature, we don't have a really good comparison, and exactly. I think that we are very lucky to have so much good NSAIDs on the field. I will say do your own experience, but I will not recommend one more than one. It's really up to you to do your own experience, but they are all very good NSAIDs, in terms of reducing inflammation.
There's one interesting question. Any studies on the use of cannabinoids like CBD oils in the management control of pain in ruminants?
To my knowledge, no. I know that some farmers, especially in organic farms, try to use plants, not CBD, but other plants. But there is no real, to the best of my knowledge, we don't have study on that. Probably interesting to conduct.
Yeah, okay. Well, I think we can't answer every question, so I'm sorry for that. Again, I thank you very much, Professor Guatteo, for your talk. Very interesting talk, very complete talk. We'll invite you to stay tuned, of course, because we will have in the next webinar will be held in the 4th of June with Dr. Owen Atkinson about talking about lameness. So I invite you to stay tuned for this and to register for the next webinar. Again, I thank you very much. Thank you for all attendees, because we were almost nearly 400 people listening to your talk, Raphael, and it was really a great intervention. So thank you, everybody. Enjoy your evening, and see you next time in June.
Yeah. Thank you very much.